afternoon, Ms. Smock. How's it going?
Good.
Can you please confirm your date of birth and your full name, please?
Jessica Mock, 10-2-92.
Okay, is there any chance of pregnancy?
No.
Alright, what's been going on with your right knee? That believes that we're gonna do right knee?
Yeah, I kind of tripped up going up the stairs. Yeah.
For how long?
About a week ago.
Okay, and the pain, you said it's on the inside or the outside?
Yeah, it's kind of like the outside of me.
Okay, so let's get started. You're gonna be lying down facing up with your head on that side. Okay, with your head. Thank you. So we're gonna do the central ray, 1 inch below the apex of the patella. And we're gonna collimate 10 by 12. And the technique that we're gonna use is 80 at 6.3. And the tube angulation is gonna be used at 5. And we're doing the AP of the knee. And the SID should be at 40 inches. And I'm checking that my tube and my plate is detented. And I'm put my marker on the lateral side. And I would use a pen to show the tank where the pain's at, which is the lateral side. And right now we're at 40 SID, central ray, where it should be at 10 by 12. And at this point, I would shield my partner, my patient. And X-ray. So now we're moving on into the medial oblique of the knee. We're going to rotate the lower limb 45 degrees. And collimation is still 10 by 12. My central ray will be half an inch below the apex of the patella. Tube angulation is still at 5 degrees cephalic. And my technique will stay at 80 at 6.3. And I'll check that I'm still detented to my plate. I'll place my marker. My patient's still shielded. And I'm still indicating where the pain's at, which is the lateral side. And at this point, I'll still keep the SID at 40. SID. And at this point, I'll X-ray. Now we're gonna do a right lateral knee projection. So now I'm gonna have Ms. Smock, please go on your side, facing me, please. This knee, you bring it forward. This one is at 20, 30 degrees. And my central ray will be 1 inch distal to the medial epicondyle. My collimation will stay the same, 10 by 12. Here's my marker. Lateral side. I'm gonna shield my patient. My tube angulation will stay 5 degrees cephalic. Check that I'm detented with my plate, which I am. So it affected knee, which is the right knee, will stay 20, 30 degrees flexed. And the technique that I'll use on this one will be 81 at 7.1. And the SID will stay at 40 inches. And at this point, I would X-ray. Now we're gonna move on onto the Bricklayer method. I'm gonna have my patient flex her right knee about 60 degrees. I'm gonna place this tissue box or glove box to help me get a less OID of my plate in the right knee. Place my mark on the lateral side. And the central ray is going to be parallel with the long axis of the tibia, entering half an inch below the apex. And my collimation will be 8 by 10. And the technique that I'll use on this one would be 80 at 6.3. SID stays 40 inches as well. Make sure that my patient is shielded. And at this point, I will x-ray. So this last one we're doing is going to be the set gas method. The central ray on this one will be perpendicular to the joint space between the patella and the femur. And my tube angulation would be 15 to 20 degrees from flex or right knee. Collimation will be 4 by 4. SID should be from the knee to like 40 inches. SID. I'm going to try to flex the knee until the patella is perpendicular to the IR. And the technique that I'll use on this will be 70 at 2.8. Make sure my patient is shielded. This one, I'm gonna need Miss Moss' help. Hold the IR, slightly tilted towards her knee. Place on the right marker. At this point, I would x-ray. So we're going to start with the criteria of the AP projection of the knee. We're looking for proper collimation. We're looking for a fully extending knee if the patient is able to. We're looking for the entire knee without rotation. The patella completely superimposed on the femur. And looking for an open femoral tibial joint space and equal space if the knee is normal. Now we're looking at the lateral projection of the knee. We're looking for proper collimation, knee flex 20 to 30 degrees in true lateral position, femoral condyle superimposed. We're looking for the fibular head and the tibial slightly superimposed. And we're looking at the joint space between the femoral condyles and the tibia. And we're looking if there is an open patellofemoral joint space. Now we're looking at the AP oblique projection with medial rotation. Once again, we're looking for proper collimation. Tibia and fibula separated at their proximal articulation. We could also see both tibial plateaus, an open knee joint, and the patella projecting slightly beyond medial side of the femoral condyle. Now we're looking at the Butler method. We're looking for proper collimation, open interior chondral fossa. We're looking at the interior chondral eminence and the knee joint space. No rotation as demonstrated by a slight tibiofibular overlap. Now we're looking at the Setigas method. Evidence of proper collimation. We're looking at the patella profile, and we're able to see the femoral condyles and intracondylar sulcus. And we're looking at an open patellofemoral articulation.